Today, we're diving deep into a topic that might really shift how you think about epilepsy.
Yeah, it's this surprising and honestly pretty critical link between epilepsy and, well, heart health.
Exactly. We've been looking through a report, pulsed together findings from 5 key studies,
hmm
and our mission here really is to get to the heart of the risks that seem inherent to epilepsy itself.
And also to grapple with the role of anti-seizure medications, the ASMs, which is complex,
Yeah.
sometimes contradictory even.
It really is. What's so interesting, as you said, is this emerging idea the sources talk about.
The epileptic heart, that's the term sometimes used.
Right.
It's this concept that having epilepsy, just the condition itself, separate from lifestyle or maybe even meds, might increase your long-term cardiac risk.
That's a huge shift in perspective.
It is.
And that idea, the epileptic heart, it feels like the core finding coming through these sources. Epilepsy isn't just neurological.
No, it appears it might inherently bump up the risk of heart complications. It's not only about treatment side effects.
The condition itself seems to be part of the story, raising the stakes for your heart.
And there's data in these studies. I mean, one study found epilepsy is linked to a 36% higher long-term risk.
36%.
Yeah, 1.36 times more likely of developing any kind of cardiac arrhythmia, an irregular heartbeat.
Wow.
And importantly, this seemed independent of genetic factors, suggesting it's tied more directly to having epilepsy.
Just having epilepsy raises your risk of an irregular heartbeat by over a third. That's significant.
It is. And another study highlighted something related but different.
Okay.
It found that patients with epilepsy who were also on ASMs, they faced an even higher risk,
How much higher?
58% greater. So 1.58 times the risk of major cardiovascular events, think heart attack, stroke, compared to controls.
58%. These are definitely not small increases we're talking about.
No, certainly not. But this is where it gets really tricky.
The medication part.
Exactly. What the sources call the anti-seizure medication conundrum. You'd hope for clear answers, right? Like, this drug is risky, this one's safe.
Yeah, a simple list.
But it's not like that. The studies show conflicting results. For some ASMs, one paper might hint at a protective effect,
Okay.
while another points to increased risk, or maybe no effect at all, sometimes for the very same drug, or similar ones.
It's a really nuanced, kind of contradictory landscape. Makes treatment choices difficult, I imagine.
It does, and this lack of a simple answer really highlights some key clinical implications discussed in the report.
Like what?
Well, fundamentally, the need for integrated care, cardio-neurological care.
Meaning neurologists and cardiologists really need to be talking to each other about patients.
Absolutely. Managing seizures and managing heart health, they aren't separate silos here.
Makes sense.
The sources suggest things like routine baseline ECGs and then periodic checks.
Those are the heart rhythm tests.
Yeah, exactly. Especially important if you already have other cardiac risk factors, high blood pressure, cholesterol, that sort of thing.
And this complexity must feed into choosing the right ASM for someone.
Definitely. It points towards really personalized ASM selection. Doctors need to weigh seizure control against your specific cardiac history and risks.
Are there any specific drugs mentioned as maybe being safer from a cardiac standpoint?
Well, the report does note that several studies they reviewed suggested levetiracetam and lamotrigine seem to have a more favorable cardiac safety profile compared to some others currently.
Okay, that's useful context.
But it's not just about the drugs. It's also about managing the whole picture. Holistic risk management,
You mean?
meaning actively looking for and treating those traditional cardiovascular risk factors, hypertension, diabetes, high cholesterol. It becomes even more critical in people with epilepsy because their baseline risk might already be elevated.
Right, because of the epilepsy itself.
Potentially, yeah.
It's clear this is still evolving. Do the sources mention where research needs to go next?
They do. There's a need to sort out those contradictions we mentioned for drugs like lacosamide and carbamazepine, for example.
Yeah.
Finding biomarkers, maybe blood tests or scans that could predict who's at higher cardiac risk would be huge.
Yeah.
And really digging into the precise mechanisms. How exactly do epilepsy or these drugs affect things like cardiac ion channels, the tiny electrical gates in heart cells?
Well, lots more to learn then.
Definitely. So if we bring this all together for you listeners,
Yeah, the main takeaway.
it's that epilepsy and heart health are, well, deeply intertwined, much more than we maybe used to think.
Right. Understanding the risks, both from the epilepsy itself and the complex picture with medications, is just crucial.
It really is. for managing the condition effectively.
This deep dive really hammers home why we need a truly holistic approach. You have to consider heart health right alongside seizure control. It's about the whole person.
Exactly. And maybe a final thought for you to ponder.
How might this growing understanding, this idea of the epileptic heart and the complex drug effects, how might it actually change the standard of care for epilepsy down the road? Pushing us towards truly integrated care where brain and heart are always considered, together.